Welcome back to the show. It is Medical Monday today. Hair loss, or medically known as alopecia, can impact 80% of men and 50% of women by age 70. Here to talk about what you can do, we welcome Dr. Wasim Nasir from the Hurley Medical Center to fill us in. First off, kind of a sensitive topic for some people out there, but talk about how many people experience hair loss.
That's a great question. So when it comes to alopecia just means hair loss. And there are different types of hair loss. Every decade after the age of 20, about 10% of men lose their hair. So at 20 years old, 20% of men lose their hair. At 50%, and about 70 to 80 years old, 70 to 80% of men lose their hair. And it can be quite debilitating for patients, both psychologically as well as emotionally. But the good news is there's a lot of treatments that we can do, both FDA-approved treatments as well as non-FDA-approved treatments that can help bring the hair loss back. Yeah,
talk a little bit more about some of the advancements that have been made over the years.
Sure. So when it comes to hair loss, the first thing we have to do is determine, is it scarring or is it non-scarring? When it comes to scarring alopecias, they're not completely reversible, but we can get a lot of the hair to come back. When we talk about non-scarring alopecias, we can get most, if not all, the hair to come back. And the hottest thing in alopecia or dermatology right now is the non-scarring alopecia, alopecia areata. Now that condition is an autoimmune condition where the body's immune system attacks the hair, causing it to fall out. And some of the images that you show on TV, you can also lose 100% of your hair, both on your scalp, your eyebrows, your eyelashes, but there are some newer approved FDA medications over the last couple of years, what we call Janus kinase inhibitors or JAK inhibitors, where we can get most, if not all, the hair to return. And patients' lives have been completely changed. It's quite remarkable, actually.
Yeah, so you talk about some of these factors that play into this. Can you kind of talk a little bit more, though, about these immune disorders and why does it attack the hair?
So what we know about alopecia areata is that it is associated with other autoimmune conditions, most commonly thyroid disease. So we like to screen patients for a TSH, or a thyroid stimulating hormone, to see if they have any thyroid disorder. It can also be associated with type 1 diabetes, pernicious anemia, but those associations are a little bit more loose in the literature. The more common alopecia that most of your viewers are experiencing is androgenetic alopecia, or male and female pattern hair loss. And for that, we have a myriad of treatments. There are currently 2 FDA-approved medications. Good old Rogaine, which you use twice a day, is very effective. And for men, we can use Propecia or finasteride. And then there's PRP, which are injections that we can do. There's hair transplant that Dr. Bawadi does in Auburn Hills. There's a lot of fantastic things that we can do for hair loss. Yeah,
so bottom line, hair, I guess, does play into the expression of oneself. Talk about just the satisfaction you see, though, in helping patients.
So there are 2 things when it comes to hair loss. The first thing is when a patient initially clinically presents, it's very emotional, both for the patient as well as their spouse, knowing that they're aging, or why are we losing hair, or what's going on. So the first thing I do as a physician is, why are you losing hair? So alopecia, again, is just a symptom, but the most important thing is, what type of alopecia do you have? Once we can identify that, we can target treatment to get the hair to come back, and patients love it.
There you go. Thank you. A lot to learn. Thanks for filling us in this morning on that topic, and thanks for the work you do.
Oh, my pleasure.
Good to see you.